Hi, everyone. My name is Max Boykin. I am the manager of the Save HIV funding campaign, where we're fighting to save HIV funding and expand our people's access to healthcare. And one of the first pieces that we wanted to do with this year's training series in 2026 was talk around civic engagement. We understand the importance of civic engagement in this very important year, such as 2026. We know many people have gone through primaries that's kicked off earlier this year, and we have many more important elections to go on. But we also have to understand that civic engagement is so much more than just voting. And for us, we are going to go through in this part one of our training series to talk about one, what is civic engagement, type of ways that people can do civic engagement, especially around advocacy. And then you're going to hear from our friends at both Collier Collective and Positive Women Network USA around ways in which we have used this around our way to be able to not just be able to save HIV funding, but also ways in which we are continuing to advocate in an intersectional way across the country, and in a way that we connect both our national work, our federal work, to both things that are impacting people globally, but also locally in our local communities. So thank you all so very much for joining us. We will give a chance for each of our panelists to introduce themselves right before they get started, giving a breakdown of what they are here for in this training, both from Positive Women's Network and Collier Collective. But first, I'm going to give us a little bit of background about what is civic engagement. So civic engagement means working to make a difference in the civic life of our communities and developing the combination of knowledge, skills, values, and motivation to make this difference. It means promoting the quality of life in a community through both political and non-political processes. And shout out to the Knicks winning the championship most recently. And this because this excerpt actually comes from the New York Times in 2000. And it's actually from a book, Civic Responsibility in Higher Education. So we wanted to give that shout out to folks, but we also understand that for folks to be civically engaged and civically responsible folks, we also understand we are members of a larger social fabric, and we're also trying to engage people around how in which we can make sure judgments are made, be it if we're putting and making sure that folks have access to proper roadways, if people have access to proper healthcare, which of course many of us talk about on a regular basis. But we also understand that all of these things are connected, and there are different ways to civically engage. And here you see, and this was created by the University of Illinois, but there are many different types of engagement. Many times you'll talk about civic learning, but that is also, some of we call it civics or social studies in school, but that is learning around what is and how in which these processes are made. We also have constant ways around community service or volunteerism, which many of us find is like many times our first way of engaging with the political or civic engagement. Then there's also like learning services. There's community engagement and research, which many folks are connected to different ways in which research and understanding how research impacts us, how research that is impacting not just our health, but also research about how in which people are civically engaged, how many people are understanding of these different issues. That is also the engagement and community engaged research is important. We have folks that have done different levels of internships, but also social enterprising or creating new organizations, or social innovation, which I've also seen. A lot of us also engage with philanthropy or fundraising to make sure that we are able to make sure that the programs that we are running or the services that we're giving to people are continue to be able to engage. And then we also, of course, in the first one on here is political engagement, but one around how in which you engage with the political process, which includes voting, getting people out to vote, canvassing, and others, in which you will hear about numbers of different ways of which and ways in which people civically engage from our next couple of speakers. But the one that we're going to talk about a lot on this is a type of advocacy or activism that people take. And there's many different types of advocacy. There's self-advocacy, advocating for oneself. And you can be doing that if you're in a if you're in the doctor's office at times, or if you're advocating for oneself and getting a job. There's also systems advocacy, advocating for systems to change. And this can be your criminal legal system. This could be just the way in which systems of reimbursements that go within your community or your organization. The thing that we'll be talking the most about is a form of legislative advocacy, which is speaking with elected representatives, senators, and representatives to make laws and policies that support our communities. Uh, there's many also different types of different legislative advocacy. And you'll hear about the different ways in which we do some legislative advocacy here. But we also understand that legislative advocacy, and many times, is controlling how in which our systems are able to make decisions and able to actually continue to support us. And especially when we're talking about HIV funding, but also healthcare access in general, we understand that a lot of that is controlled within legislative processes. And then there's also different ways in which you can advocate. And Bill will actually go into a lot of more of this, but you can meet with legislators and elected officials. You can invite them to different organizations in different spaces that you're having, which you'll hear more about from our friends at PWN. You can also write email letters, and you will see more and more engagements that we'll talk about ways in which you and continue to email and send out letters and postcards to both elected officials, but also engaging with your local newspapers and other ways to also make sure that they understand the importance of these life-saving medications. You'll hear more about calling from others, and we'll save more around the voting and engaging around getting people out to vote in our next part of the series, which we will have a civic engagement part 2, and you'll hear more about that towards the end of this training, but that will happen in July. And then there's a number of different tactics that people can take, from boycotting, political education, canvassing, rallying, forming different coalitions, having community meetings and attending town halls. There's even also bird dogging and taking different direct actions. And there's also joining, and as many of y'all have done today, in joining a training. So we understand that there's so many different tactics, and also even engaging earned media, signature collection. There are many different ways in which we do these, and you will hear from many of the folks on this call. There is no one tactic that fits all, and I would also say there is no only one tactic that you should do. You should actually engage in multiple tactics. But what we're going to talk about, and as I pass it on over to Bill McCall, who is with Collier Collective and has years and years of experience in being able to be an advocate, not just in DC, but helping many folks being able to do deeper levels of in-district meetings, being able to change policy. And I cannot say this without also giving him a big shout out in the work that he has done around harm reduction, not just here in the US, but also engaging in it globally. Without further ado, I want to pass it on over to Collier Collective's very own Bill McCall to talk around some of the uses of how we have used some of this strategy, and how in which Save HIV funding uses some of these different tactics in our larger strategy to save HIV funding. And without further ado, Bill.
Thanks so much, Max. I really appreciate that introduction. And I'm laughing about the years and years and years of experience. Actually, I think just a lot of folks on this call know me. And so I really appreciate your friendships for the folks in the audience. Also, many for years and years. So that's great. Also, Max, I did notice that you complimented the Knicks, and it made me wonder if you lost a bet. But I'm very happy for the Knicks, and I love that community engagement. So that's really great. Um, I want to talk about basically three buckets, really. First, I want to talk about why and how the United States is a little bit different in some ways around civic engagement, and what that kind of means. I do want to talk a little bit about very specifically what is our Save HIV funding strategy and how that relates particularly to the federal level and approaching Congress. And then I want to just try and provide some practical tips for advocates around approaching their members of Congress in a couple of different directions. And I think that will set us up nicely for some very practical activities. But the first thing I want to start with is actually the Constitution of the United States. And I don't know how often people go back and read their pocket Constitution. I bet it's not that often. But I want to specifically bring up the First Amendment of the U.S. And what that says is Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof, or abridging the freedom of speech or of the press, or the right of the people to peaceably assemble and to petition the government for a redress of grievances. And it's just a really interesting thing. And we often have a tendency when we talk about the First Amendment and its jurisprudence and all that to focus on, the freedom of religion or the freedom of speech and all of those kinds of things. I want to focus on the very last phrase there, which is to petition the government for a redress of grievances. It is written right into the Constitution that the people are able to come and speak to their government. And who is the government? Well, the government is the federal branches, but particularly the administration and the Congress. And in fact, we're very specifically set up with members of Congress. Most folks, I live in Washington, D.C., so I'm not most folks, but most folks will have one representative and two senators in Congress. And they are, in fact, the folks that you're voting for when you go vote, but they're also the folks who are the conduit for your voices. Now, sometimes they are ideologically differently aligned or things like that, but I think it's really important. They often don't know a lot of the basic realities of things like living with HIV. What is it like to be a person living with HIV? And how does somebody who is living with HIV access their care and treatment? How does somebody who does not have HIV but is at risk for HIV protect themselves? All of these things, prevention and treatment, what's the need for research? Members of Congress are not necessarily coming into that office with very much knowledge about HIV. And one of the things that I frankly find with a lot of folks, not just members of Congress, is that people are stuck in the time that they first learned about HIV. And that means for a lot of us, we kind of hear about HIV and think about the 90s and oh my gosh, how terrible, or the 80s, and the reality is that things have changed immensely and folks don't know that. So that brings me to a discussion really about what is our Save HIV funding strategy. And the reason that I think that the whole Save HIV funding campaign exists is to frankly bring the message about where we are in reality with HIV, particularly to Congress, but also to the administration. Because there are a lot of folks who have come into Congress, who have come into this administration with an idea that this is no longer an important epidemic. We've solved the problem. We could save a lot of money here if we just stop funding these programs. We don't need to do that anymore. Well, that is not the actual reality. In fact, we have a real opportunity to actually end the HIV epidemic. And the idea that, oh, we've already solved the problem, or, oh, this problem is just intrinsic and we can never do anything about it, that is all wrong. And that's where people with lived real experience can actually make a major difference. And one of the reasons that we are calling on folks to try to reach out to their members of Congress and to reach out to the administration through a number of different things. But our strategy actually is built on filling a gap that we've identified, which is that it's kind of hard for people living with HIV just to go talk to their members of Congress without having talking points, without having the knowledge necessarily about what are the current issues that Congress is discussing that we should talk about. If you're living with HIV and you have access to Medicaid, that is not something that you necessarily know when Medicaid is at risk through a reconciliation bill or things like that. And the Save HIV funding campaign is trying to close that gap. In short, we are trying to make it possible for people living with HIV specifically to go speak, i.e., to go petition their members of Congress, the government, to redress our grievances. So that's what our entire strategy is built around. Now, coming back to what Max was talking about earlier, there are a variety of ways to do that. I'm going to just focus a little bit right now on what we call appropriations, which is basically Congress's final decision about what money to send to the agencies work with to work on either preventing, treating, or doing research for HIV. And I'm just going to do that at the very highest level because I'm going to encourage folks to come and join us on Tuesday calls where we actually once a week all get together and I'll usually provide long, big updates about, well, hopefully not too long, but fairly good updates about the what's going on in Congress, what's going on with the administration. We could talk more about that there. I'd like to get to the tactics and talk about practical tips for advocates about how to engage more than about where we're at. But I do want to say we have all been working on main legislation for appropriations for three bills: the Labor, Health, and Human Services Bill, which is where the variety of HIV prevention through the Centers for Disease Control and Prevention is located. 90% of that funding that's going to CDC is coming to the states to do surveillance, to do prevention activities, to going to local health departments to do testing and provide things like PrEP. So that's one bucket. Another bucket is also in labor, health, and human services, and that's primarily treatment, which is especially coming through the Ryan White program. That's appropriations, and that is treatment funding that goes to the states. It goes to large cities. It goes to directly to clinics and to organizations, community-based organizations that work with families on HIV. And it also goes to help educate, train, and for dental programs and even a little bit of research. So that's out there. And then a third bucket that's in the Labor, Health, and Human Services bill is the National Institutes of Health that do the research on, particularly a lot of basic research that have led basically to the discovery of drugs that treat people living with HIV, helping us to live longer, healthier lives, helping people living with HIV to live longer, healthier lives. They've also helped to develop the drug combinations that help to prevent HIV, helping us to prevent acquisition of new cases. And a spinoff is that they've really contributed a lot to knowledge around things like HIV and aging and general aging, cancer, and things like that. So we've been following that bill very closely, but we also are following housing, the housing opportunities for people living with HIV/AIDS, HOPWA, as people will know that. And that's in a different bill, the Transportation, Housing, and Urban Development. And then we are also following the global funding for HIV because HIV does not have borders. I should have worn my t-shirt. HIV knows no borders. So those are the things that are there. All of those three bills have passed the House full committee. And the thing that's important to know about that is that while they maintained the while the House maintained funding, level funding for parts of that programming, particularly for HOPWA, and they maintained level funding for PEPFAR. They cut a lot of funding in other spaces, specifically for USAID globally, and then they cut out almost all funding, with the exception of the Ending the HIV Epidemic line for prevention, and they cut out funding for education, treatment, research, and for the ending the HIV epidemic in the Ryan White program. So those are things that we could call about. I'll also say that a place that you can also petition is you might be hearing about reconciliation bills, that one big, beautiful bill act that in many ways was in fact an ugly bill. Um, Cut Medicaid, which is where 40% of people living with HIV receive their funding, and that is also something that we can weigh in on. All right, I'm starting to go very long, and I haven't even reached the tactics. So I'm going to switch over here and just talk a little bit about doing meetings, about doing phone calling and phone banking, and about emails and mail responses to action alerts and when you should do them. Very quickly, I will say that we have been working very hard to create the conditions for doing in-district meetings with folks right in district, maybe with the staffers, maybe with the members of Congress, or in your state for senators. And I think that's really exciting. I'm going to tease something, which is that we do have a target list that we plan to release Tuesday on our call. And we are getting close to being able to release our new version of the toolkit to do these types of meetings. We had one for World AIDS Day last year, and we're doing one for the 4th of July recess and the remainder of Pride, as well as into the fall through elections this year. So that is all coming up, and you'll get to see that. One thing that's really important about meetings is that this does not have to just be a meeting at their office or something like that with activists or things like that. It could be a visit to a clinic, or it could be a participation in a community event or an awareness day, or maybe invite folks to come in to staffers, Hill staffers to the Ryan White Planning Council. What this does is it does a lot of relationship building. It highlights the actual local impact of this funding, and it helps constituents to become a trusted go-to voice. And that really carries a lot of extra weight. And I'll just say something else. If you're doing a meeting in the district, they're a lot less rushed than they are here in Washington, D.C., and it helps you to meet the staff, and it'll help you to make those kind of continuing connections, even if you go to Washington, D.C. And I will say that it's helpful to do fly-ins in Washington, D.C. if you can. If anyone's coming into town, let me know. I'll help set you up with meetings with your legislative staff here. Usually, doing these meetings in DC can show a lot of commitment, but it's a lot more expensive, and schedules tend to be really tight and things like that. So that's why we really recommend a lot of those in-district meetings. I also think it's important to know, you don't have to just necessarily do meetings. Sometimes when you've got a really urgent issue that's coming up, doing phone calls to congressional offices is really important. And one of the things that we know about doing those phone calls, when they're coming from inside the district, those things are tallied up by issue and position, and they report the totals to the members. And it also, it's a lot harder to ignore a message that's coming via voice rather than some kind of a generic form email or something like that. So it also can humanize the ask. It's really fast. You've only got 1 to 2 minutes. You just want to stick to a clear request and maybe a personal story. And you can also leave a voicemail. They'll tally all of that. I will just say this. The HIV community can do this. We've done it before. I told a story. This comes back to my years and years doing these things. When we did the last reauthorization, we literally had Ted Kennedy's office calling me to say, "Can you please stop the phone calls? We've got enough phone calls," because we were calling so much and so often. We need to be able to get back to that space where we can do that. I'll also just say there is a place for emails, especially personal emails, as well as email responses to action alerts. The thing is, they're scalable. You could do them for frequent advocacy, and you can document your ask in writing, and that really helps. But it is also a little less personal than a phone call. Okay, I feel like I'm starting to go really long here. In fact, I know I have. So I'm going to turn this back over to Max, and we'll go forward from there. But that's really what I want to say. It's incredibly important to continue engaging in these civic pieces. And it's really important to remember this is your First Amendment right. Make use of it.
Thank you so very much, Bill. That was absolutely incredible. Thank you for giving an absolutely like a breakdown and wonderful of like also how we have used this strategy, but also giving folks a lot of tactical options within that. And thank you for all of the work that you have continuously done. With that, I'm going to pass it on over to our next set of presenters from Positive Women's USA. That is important for all of the work that we're able to do as an organization. We have two amazing presenters. First, Barb Cardell, who is the program director at Positive Women's Network, and has been there with joining the steering committee in '09. Was the board chair for over 6 years. Has been engagement, and Save HIV funding wouldn't be able to do all of the different actions that they've been able to, and important for what we're able to do in Colorado, but also in DC and across the country, and important for the entire training for the training series that they're doing, and is one of the important peoples of the Colorado Alliance for HIV Prevention and Education. Shout out to Barb Cardell. And then I also want to give a shout out to our other presenter from Positive Women's Network, from my parents' home state of Alabama, is Myra Franks, who has been a part of PWN since 2018. Myra is a ribbon ambassador, is I believe a USCHA ambassador right now as well. Has done a lot of pieces, especially for outside in West Alabama, and has also been a reproductive justice fellow. Just has an amazing work doing that in the state of Alabama, and I want to give a mad shout out to Myra Franks and Barb Cardell, who are about to do a wonderful presentation for y'all around in-district engagement, accountability for elected officials by people living with HIV. And so without further ado, I'm going to pass it on over to Barb and Myra to really get into it. And thank y'all so very much for joining us.
Absolutely. Thank you so much, Max, for that extensive and detailed introduction. Appreciate it. So glad to see all of our friends here. Hi, everyone. We are here to talk about the work that PWN has done, not just for our members. And we very intentionally say that when we talk about in-district organizing, that we're talking about work by people living with HIV, because while we are the national Positive Women's Network, and our members are cis and transgender women, gender diverse folks, and transgender people living with HIV. We come to this work knowing that there are 1.2 million people living with HIV in the United States, and that we are a powerful bloc. When you add in the allies that we have, we can shift policy. We can connect with elected officials in a way that shows that the needs of our community are critical and must be lifted up. And so thank you once again. And we really are here because when we're talking about in-district organizing, that sometimes sounds like a tactic that political insiders use. Really, we're talking about holding your elected officials accountable. It's easy to get wrapped up in the ongoing campaigns. Those are important, but it is also important to hold the people that are in office accountable for the votes that they have taken, to remind them of promises that they have made that have not been upheld, and how current policy that they're voting on now is going to impact our lives. And so we need to be multi-tactic, multi-strategy people, and we often are, and that's so important. So next slide, please. Okay, there we go. Just want to briefly introduce everyone to PWN in case you haven't heard about us. We are, as I said, a national organization that is led by and for our community members. And today is our 18th birthday, and we want to invite everyone to join us for a birthday celebration if you are available, because we have been doing this work in partnership with so many of the people on the call, knowing that when we advocate for ourselves and our needs, that we are most able to elevate and to share what is critical. Next slide. So when we're talking about in-district organizing, again, that sounds like something that political insiders do. It's about connecting with, the elected officials' offices or staffers. But really, I love it when we're talking about civic engagement instead, because ultimately what it is community holding the people that are in office to represent us and airing our grievances. And Bill, thank you for the call back to the Constitution, because this can be a phone call to the office. It can be a meeting in their office when they come back home or when they're in district. And we're just getting ready for the 4th of July week to have a lot of time that they're going to be at home in their office. And so we have a chance to call their office back in our state and talk to them and talk to their staffers and to lift up these concerns that Bill has actually talked about. We can go to town halls. One of my favorite things to do is to actually find out what 4th of July parades they're going to be marching in. And I actually will sort of jump into the parade and walk along with them with a sign that says something about Save HIV funding. So these are all tactics that we can use, because what we're doing is we're building connections with them. We're talking to them about the issues that we know that are so critical. And the reason why we're so proud to be a partner with the Save HIV funding is that we know that when the communities that are most impacted are a part of these conversations, are framing the talking points, are actually leading these meetings, that is when change happens, not only within the individual advocate, but also with the elected official. And so at PWN, because we're an advocacy organization, we want to make sure, and we tell all of our members, that these meetings are so critical, because decision makers need to hear directly from us. They need to hear from real people. They need to hear real impacts. Oftentimes we'll have folks that provide services or medical providers who are able to come as well, and they have a story. But we don't really want anyone telling our stories for us, because we can be targeted, we can share the impact, and we can share the connection to us and our lives. And hopefully by making that connection, we are able to connect the policies that often seem really lofty and disconnected to the people back to the state and back to the people that they know. One of the most common things that I hear when I go and I talk to elected officials is that they believe that they do not know someone living with HIV. Now, based on the number of people living with HIV in the United States, we know that is likely not correct, unless they live a very sheltered life and they only have maybe one or two friends. The reality is that most people know someone who's living with HIV, but they don't know someone who feels safe enough to be able to share their stories. And so by being willing to go and to make connections for them, oftentimes we are helping to educate them. And my role will speak a little bit more about that in a moment. Relationships build influence. When you have the personal email or the cell phone of the staffer who is scheduling for an elected official, you then are able to connect with them and not just share information with them about what's happening in the state, but also they can reach out to you if they're looking for somewhere to go, for example, for World AIDS Day. And that kind of relationship building is not just about kind of this transactional, what do you do for me? What do I do for you? But it also is about building trust, so that when they are looking for stories, for example, that say why saving Medicaid is so critical for people living with HIV, you actually are there and they'll reach out and you can share what's happening in their state, in their district, with people that they are representing. And that is so critical. We want to talk about sharing power. And I'm just going to say this, and I apologize if I hurt anyone's feelings, but sometimes some of the big organizations come in and they try and speak for people living with HIV or people who benefit from prevention services, and they don't actually really represent us. They might be worried about protecting their funding. They might be worried about a number of other things. But when we are there and we are in shared community settings and we are able to talk for us about us, that disrupts traditional power dynamics around who is receiving services, who gets to speak, and who gets to actually share what is so important for us. and it strengthens our movement. For people like me who are aging a little bit with HIV, and I've been living with HIV for 35 years now, I want to be able to retire at some point in time. And so by building these opportunities for people to come in and to talk to elected officials and understand the power that they have in their experience and their subject matter expertise, that is building our movement and strengthening our leaders as well. And then finally, when we can make real factual connections between the cuts to programs, the funding for programs, and the impact it has on our lives, that is a powerful, powerful connection that then shows to the elected official how we're doing. And so I'm going to go ahead and stop there. We have a number of opportunities for PWN. We're going to do a phone zap next week for if anyone wants to join us. We would love to have you join. We're going to be calling about the really wretched interim final rule on Medicaid that was just passed, and I'll put the links in the chat. And we also have a toolkit, a resource around HR1, the one big ugly murder bill, and the impacts that we're going to be seeing with that. Yep, I overdid it with the slides, Max, and I know you're flipping through. I'm going to go ahead and put the links because I want to make sure that we have time to hear from Myra talking about their in-district organizing that they did in Alabama that is a gold standard and something that is really spectacular. Myra, to you.
Well, thank you so much, Barbara. And thank you again, Max, for that wonderful introduction. I didn't know I had did all that. Ooh. But the in-district meeting that we had, it was a collective effort of a lot of organizations. Bill McCoy, he came down, not came down, but he was on a call with us and gave us some really great tips on how to hold this meeting. We got information from Save HIV funding campaign, as well as a lot of help from our organization, the Positive Women's Network. Now, in this picture, it shows us with my co-chair of the Alabama chapter, Katie Willingham, who was instrumental in helping me with this meeting. I was afraid. I know what the political climate is that we live in, and I also know what district I live in. So it was kind of hard to step into that space with the representative from Robert Adderhold's office. Also in the picture, we have one of my kinfolks. Her name is Catherine Stowe, and she wanted to talk about Alzheimer's. So what we did was we kind of combined HIV and aging with her issue. She lives right here in Fayette, and it worked out really well. A lot of times, the people in these in-district offices, they don't really know anybody living with HIV. So we had to kind of change our routine, pivot from talking a lot about the funding and other issues, because he didn't know anybody living with the HIV. First of all, I did assure him, just like you said, Barb, that he probably is, but they're just too afraid to tell him because of how they feel he might react. He had never heard of the Ryan White program, and he had never heard of Ryan White. So it became more of an educational session with him. And in getting these meetings, it's really important to be persistent. When you're getting in touch with these offices, you have to be persistent, because I don't think that they think that we were really serious about having a meeting, or would be have so much helpful information that he could look at and see. We took out the time to get in touch with our local ASOs that are in this district here in Alabama, District 4, and give him numbers about how many people living in this district were being serviced by these ASOs. So, and I think that kind of touched them there, seeing this how he didn't know anybody living with HIV. Okay, uh, but just getting in, being persistent, giving them the information that can educate them, that helps out a lot. That helps out a lot. And do follow ups after the initial getting in, getting connection, setting the meeting, having the meeting. It's good not to have a really big group depending on what the meeting is about and where you have it. Town hall settings, they might be a little bit better for more people, but we had just an intimate setting at a coffee shop here in Fayette for our very first in district meeting. We have been invited back to speak with him, which he wants to do it after the 4th of July, but we're going to send him another email reminding him that we need to set this meeting and give him more information about the bills, the cuts to the bill, the cuts that they are trying to propose in these bills, because they need to know that we are here and when we matter. And just like it's been said before, people who are living with HIV, we do need to let them know what our needs are. I like to give the analogy of the strawberries. Strawberries are good for you. They're healthy. So they come into our area and give us a boatload of strawberries, but half of our people are allergic to strawberries. It doesn't do any good. They need to come and talk to us before they bring that into our area so they'll know exactly what our needs are and how to best help us. Um, I'm not missing anything, Barb. What else we got to know about this meeting? Just do follow ups and know your stuff. Do your research about who you're going to be seeing. That would be a good thing too. We actually met our representative. He's kind of hard to get in touch with, and it would be hard to get in touch with him while he's out for the holiday because he doesn't even live in Alabama. I don't know if he's going to do a whole lot of in district stuff or not. So
Yeah. Yeah. Thank you, Myra. So appreciate your sharing your story of your great meeting and the opportunity to build relationships with this office.
yeah.
And we'll go ahead and we'll pass it back to Max.
Thank y'all so very much. Myra, you are absolutely wonderful. Same with Barb and Bill. Thank y'all so very much for all of the inputs that y'all have had, all of the wonderful real world experience that y'all bring to this space, and to allow for this to happen. With that, I do want to invite folks that do have questions to put them in the chat. You also feel free. Again, this is being recorded, so if you do come off of mute, you will be a part of the recording. So we do want to let folks know that as well. But if you do have questions, feel free to come off mute or put them in the chat. With that, I also want to start off with at least like one question for the group. If there's one piece of key things to think about when doing in-district engagement, what do you think is one of the key parts in thinking through and making sure that you're able to have not just a meeting, but a continued relationship with that legislator?
Maybe I'll take a quick stab at it, but I'd love for Barb and Myra to talk about it as well. And I will just repeat what I put into the chat, which is that I think follow up is the key. It's really helpful if you go in with a plan and an agenda and you know exactly what your interests are, the having some leave behinds and things like that. But then this is where the emails actually do help. I kind of mentioned very briefly the concept of doing personal emails. These guys get a ton of emails, but if you have gone in and gone to a meeting and they know your name, they're going to be a lot more responsive as well to that. And they may pick up a phone call. And I think the nice thing about the district folks is that they know they're responding to constituents, and they can put you in touch, also with the health person or someone like that. So it's that constant mix of doing the meeting and then a couple emails and then a phone call and, oh, by the way, I haven't seen you in 3 months or 6 months. We really ought to get together and check back in. I think that can really help. The other thing is, that'll also help when they turn over. There's a lot of turnover among Hill staff. They're also a lot of them are young. That's less true in the district, but it's still there. So I do think that one thing that is also good is if you have an ongoing relationship with someone, they'll make that introduction for you, and that makes it easier to keep track. All right, I want to hear though from Barb and Myra. I think that that their insight from the ground level would be fantastic.
Yeah, thank you. Yeah, I absolutely agree that follow-up is key. I say be the subject matter expert, be the expert. And so once I get a hold of somebody's email, I make sure that I thank them for every call that we have. But more importantly, I send them things that I see on the ground in my area. And so we just finished our Colorado HIV/AIDS strategy, and I made sure to send that to every office and every staffer that I've met with, because I want them to know that we continue to really try and work at the state level around this. And I invite them to events. Most of the time they are not here, but really, I actually have a little reminder in my calendar every Friday afternoon, like, what can you send to a staffer and tell them about? And so I kind of, not trying to be obnoxious, and I make sure it has some point to it, but make sure to continue to build that relationship, because we are able to help connect them to really critical information they need. They just don't know they need it yet. And so if we provide that in an ongoing basis and build and strengthen that relationship, then we're the first people that come to their mind. And Myra, do you have anything you want to add?
Yes, I agree with both of you. It is really good to I'm gonna tell you, it took a long time to get the in district meeting, and I think that they got tired of me calling and just kind of pestering them about things going on in the community. I would answer every action alert, and I might have been the only one in the country who was doing that. And they eventually said, well, we're going to just send you over to our Jasper office. And that's how we got the in district meeting. But it turned out really well, knowing what we were going to talk about when we went in the meeting. And we're thinking about the next time. We have a number of incidents involving fentanyl. So it's a really big thing right now. So we might tie in HIV to some substance use disorder and go that route for the next time, because that will really bring attention to something that they care about. So in their communities. And plus, we will still talk about saving HIV funding in our community.
Thanks,
But yeah,
everybody.
follow-ups are good.
Thanks, everybody, for answering that. I'm going to jump in because I think Max has had a power outage. So I'm going to help out with another question that Michael put into the chat that was from registration, which is, what advocacy approaches have been most successful in influencing policymakers to maintain or increase HIV funding during periods of budget cuts? I don't know if anyone wants to take that.
That's a tricky question because it's sort of hard to tell. I think a lot of the relationships that we've built up over the years, we've had champions and folks that have been key over the years, and as they've built seniority, they have the ability to do that. And I think it's helped, for example, that we are always and have been bipartisan. So we go talk to Senator Capito in Maine and Senator Capito in West Virginia
West
and
Virginia.
Senator Collins in Maine. Right along with the champions in more democratic spaces. So I think that's really clear. This point about persistence too is also really important. There's not one of us is a billionaire who's going to be able to put a bunch of people on retainer and pay for the PAC meetings and all that kind of stuff. So we have to do it the old-fashioned hard way, which is to show up where they're going to be and to engage them when they can. I loved what Barb said about finding them at the town halls or the parades or going. Don't let them just run away from you. That's I think a thing that's important. And an interesting thing as well is that sometimes if we aren't ourselves the right messenger, we might sometimes be able to find someone maybe in a business group or bring someone with us who maybe can be a different kind of messenger as well. So I think those are all tactics that have been pretty successful. I will say one thing that I think has had some resonance is that there is sort of a return on investment for HIV treatment and prevention, which is that it's expensive having an uncontrolled epidemic in this country. And so even if you're not moved by very specific public health arguments that this is a bad idea or that kind of thing, I think a lot of folks will honestly respond to. You could save a lot of money if you do this, do things in a particular kind of way. Anyway, that's just my 2 cents.
Thanks, Bill. Given the timing, I do want to just hand it over to Ed for your last question. We are going to drop in the chat for our next training. As Max said, there is a part 2 to the civic engagement training. There's going to be a whole series this summer, so we're going to put that into the chat so that people could sign up for it. But Ed, what's your question?
It wasn't really a question. I wanted to follow through on what Barb put in the chat about persistence. One of the things I learned from Housing Works is they call it bird dogging. Get the legislative individual, whether it's on the state or federal level, to commit to something and then follow through to ensure that they're following through on their word. I met a gentleman who was here when Mikey Sherrill was running for Congress, one of our colleagues, Maxine Waters, was here. And oh no, not Maxine. One of our champions always enters into a bill about criminalization on the federal level, and I asked him if
Barbara
he
Lee, you were
co-sponsored
thinking
the
of.
bill. Barbara Lee, yes, thank you. And he said that if Barbara Lee sponsored a bill, I co-sponsored it, and I checked, and he hadn't. So for the next 3 weeks, I called his office, and eventually he did co-sign or co-sponsor the bill. And I was taught that through Housing Works here in New York. They call it bird dog. Just get them to commit on something. Also, what I did want to say, we're talking particularly on the federal level, but with current political climate, we also have an opportunity to go on the state level. Because with some of the cuts coming to Medicaid, if it does indeed go through, who is going to pick up the slack? We're going to have to rely on the states, and the states aren't going to be most states are running in the deficit budget anyway. So we have to make it a priority when it comes to that. That's all I had.
Thank you so much, Ed.
Ed brings quality advocacy to the conversation. We appreciate it, Ed.
I think Max is just about back online, but I will say it is 5 o'clock here on the East Coast. I've put the flyer for our next training into the chat as well as the link. We hope that you and others will join us. Max, if you want to jump in, go ahead and jump in. But otherwise, I do think that we are going to wind down. Barb, Bill, Myra, any last critical comments before we wrap this up? Or Max, I see your face now.
I just want to say thank you to everybody here. The persistence of folks doing this advocacy has actually made HIV one of the most successful groups doing advocacy in DC, but it's also true at the state level and the local level. And I think that I think the fact that people show up for these trainings and do this work, and then we know folks will watch the training as well. That makes all the difference. So y'all are real heroes in my book.
Mm. Thanks, Bill. I'm just going to go ahead and share that when Myra and I were talking about the first time we did a meeting with our elected officials, both of us shared that we were really nervous and scared about it because it's not something that we are raised to believe we have a right to do or should even do. And both of us wanted to share that it was really important to overcome that because bravery is overcoming fear because our community needs us so much. And when we hold the love of our community, that is why we step up and do this, not because we're not worried, not frightened, not scared, but because it's so dang important.
Thank you. Myra, did you want to have a last thought?
Yes, that's so true, Barb. It is so very important, and it's a little bit, it seems harder in the rural area because sometimes you can't get people together because of distance and transportation issues, especially in rural areas. But the work is doable. We can still do the work that we need to do and get in touch with our legislators, even if we have to bring along some of our community partners and friends and family to get our points across, because we are stronger together. And thank y'all so much for having me here this evening. So
I want to say thank you, Myra. Thank you, Barb. Thank you, Bill. Thank you, Jeremiah and Michael, for stepping in when I lost power at the house. Thank y'all so very much. Thank y'all for being here. Our next training will be July 15th at 4 p.m. to talk about part 2 and talk about more about engaging candidates in an election year. And we'll be able to talk that more in future trainings through this year as we continue to save HIV funding. Thank you all so very much, and we'll be in touch very soon.
Take care, everybody.
And remember, happy 18th birthday to PWN. If you got time this evening, join them for their 18th birthday celebration this evening. So shout out to y'all and happy birthday to PWN.